And then we're going to move to the wrist, and we're going to discuss an entity that happens around the ulnar side of the wrist, or over towards the little finger side of your wrist. In that area is a ligament that has a big name called the triangular fibrocartilage complex. However, if you think about it as a sling mechanism, that's what that ligament does. So if we look at this picture here of the wrist, and that would be the wrist like this, not exactly anatomic fingers, but a good idea of the wrist joint. And this is the bone called the ulnar here. And this little bit of cross-hatching here is a three-dimensional picture that on the ulnar side of the wrist, or the little finger side of the wrist, there's a triangular appearing ligament that has cartilage in the middle of it, like a trampoline, that is much like the cartilage in your knee when people have torn meniscus in the knee. In the wrist, that is what the radius rotates around the ulnar with. So it has a pinpoint insertion into what's called the ulnar styloid, and as you rotate, it allows the ulnar to stay where it is, and the radius to rotate around. So it's very important in any kind of work that you do that may require using a screwdriver or anything that you're constantly having to put your palm up for. In that type of instance, frequently with trauma, that can be torn off of that area and would make a very unstable distal radial ulnar joint, or your rotational joint in that area. So what we do on that is frequently we're able to scope or do an arthroscopy of the wrist with a little scope, and we're able to visualize that, and through the scope we can reinsert that back into its origin. Sometimes it has to be done open if it shows chronic wear and tear, but most of the time arthroscopically that can be repaired. And in some instances it's just inflamed, and we're able to perform a corticosteroid injection in rehabilitation. So now we're going to return to the wrist, specifically the triangular fibrocartilage complex. It's a very small ligamentous complex between the bone here that's called the ulnar, the distal ulnar, as well as the carpal bones that are just on the other side of the joint that's palpable for the wrist joint. And what that does is it plays two roles. One is it keeps the wrist from sagging forward like so and keeps it up in a strong position. And number two, it allows for rotation of the forearm. And as we can see here, this is the ulnar that I'm palpating here, and the radius is in my other hand. And we can see that the ulnar stays stationary as the radius rotates around in full pronation, and then stays stationary in full supination as well. And what's accomplishing that is the triangular fibrocartilage complex. It's named such because it's in a triangular type of formation, where one limb of the three will insert into the distal ulnar, and the other two are the breadth of the radius itself. So it renders stability, and it also provides cartilage in the wrist joint that acts as a protective mechanism against impaction. As you can see, the forearm is in neutral rotation, meaning it's not supinated and it's not pronated. And here's the ulnar, which is the small bone, but it is the anchor of the wrist in terms of rotation. And this would be the radius, the other bone of the wrist, that's a bone of the forearm. And as we rotate into supination, we can see that the ulnar really does not move at all, but the radius rotates around it. And at the same time, as he goes into full pronation, the ulnar does not move at all, but the radius comes totally around. And that gives us almost 360 degrees of total pronation, supination, and ability to grasp, which I guess makes us human.